Inside Africa, in association with Zenith Bank.
One of the greatest needs in Africa today is access to healthcare. With a growing population of young people spread across both urban and rural areas, the need for pediatric doctors is more evident now than it has ever been.
It's important to have specialists in Africa, because when you become a specialist, you actually start to understand why certain things have to be done. Generally, if people are specialized, our health will improve in Africa as a whole.
A unique training program for doctors is finding life-changing solutions to some of medicine's most pressing problems.
It's not just about clinical care, it's actually quite a holistic program touching on all those. And that's exactly what is needed in order for us to reduce our under 5 mortality. An in-depth understanding of what the causes are.
This is the story of the men and women on the front lines of child health care. This is Inside Africa. In 2009, Dr. Joyce Balagade Kambugu was working with the Uganda Cancer Institute. At the time, there was no pediatric oncologist in her hospital or anywhere in Uganda. Recognizing the need and driven by her love for children, Joyce enrolled in the African Pediatric Fellowship Program.
That year of training with the African Pediatric Fellowship Program in Cape Town between 2011 and 2012 changed my life completely. It was a profound experience, and I can say without hesitation that that year changed the outlook of childhood cancer in Uganda just because of that training that I did. When I went back, I was equipped with not only the knowledge, but I think also the skills that I needed to start a dedicated pediatric oncology service. And that alone has profoundly changed pediatric oncology in Uganda from what it was.
She has offered a targeted and structured oncology service, and Joyce has now returned to formalise that training so that she comes away with a master's degree, so to go back and actually really start then implementing and building on that service further.
By building on success stories like Joyce's, the program hopes to have an impact on healthcare throughout the continent.
The lack of access to skilled healthcare workers means that often what can be quite simple interventions have not been implemented because you don't have a voice that then sets out standard operating procedures that can make a massive difference. As we introduce more skilled practitioners, they can lobby to government and actually start targeting and approaching those areas and acting strategically.
The African Pediatric Fellowship Program has taken this fight head-on. Ever since its establishment in 2007, it has aimed to train pediatric specialists and nurses from various African countries, equipping them with vital skills. The training takes place at the University of Cape Town in South Africa.
So the African Pediatric Fellowship Program is an amazing program that was established in 2008. And the aim of this program is to enhance and develop skills in pediatric disciplines across the continent, to skill up practitioners in key areas that will directly affect child health needs, and to equip those practitioners when they go home to be able to implement change. It depends on the needs for the region that they come from. So if a region such as Malawi has a dire need of paediatricians, then we will train up as many practitioners as they need in those areas. You may have situations where there's a need for neonatal care, and we will then focus on neonatology. So the program can adapt and train in pretty much any discipline that is identified as a health priority for the region that's referring the trainee.
The fellowship program offers pediatric subspecialty training in cardiology, pulmonology, and neurology, as well as other specialties. The goal is to go beyond clinical training and develop the skill sets that are vital to transforming health systems.
What the African Pediatric Fellowship Program also offers is how to not only address, it's not only the clinical care of these patients, but specifically how to lead programs within the country, how to look at the epidemiology, how to specifically look at the research aspect of the particular speciality. So it's not just about clinical care, it's actually quite a holistic program touching on all those. And that's what is needed. That's exactly what is needed in order for us to reduce our under 5 mortality. An in-depth understanding of what the causes are.
Let me see your tongue again. Okay.
With a critical shortage of trained child healthcare experts across Africa, the program encourages all of its fellows to return to their home countries after completing the training.
Before the existence of the African Pediatric Fellowship Program, most of the subspecialist training for doctors in Africa were happening outside of Africa. A lot of those trained subspecialists did not return. And secondly, those who came back were not able to apply the knowledge that they had learnt in those high-income countries to the realities within their own country. And that's extremely frustrating.
And how is our diet? Is he eating well?
And that's an immediate reason why the brain drain happens, because this skilled person, if he cannot use his skills in the place he's in, then he will go somewhere that he can use them. We found that through the program, our approach to the brain drain has been effective, that most of the clinicians that return home, they stay there, and they don't just stay there, they stay there and become key opinion leaders in the local setting.
Thank you very much. Thank you.
Bye.
Fellows are selected from a network of partner institutions across Africa. The program says they currently work closely with the health ministries of 13 countries to choose the candidates and ensure that there are positions available for them upon completion.
Since the program started in 2008, there have been over 90 doctors who have completed and returned home. And so far, the 1-year retention rate is 98% and the 5-year retention rate is 95%. And that's unheard of in any program.
One determined doctor has transformed this training into a life-saving machine. Ahead, the ripple effects of real change. When it comes to medical advances in Africa, many times children are often forgotten or too easily overlooked. The Pediatric Fellowship Program is building a network of enterprising doctors across the continent who are committed to innovative solutions. One of the countries where this training has already begun to impact lives is in Malawi.
As you may have heard, that Malawi was one of the countries that achieved the Millennium Development Goal number 4 in terms of reducing the under 5 and child mortality.
Dr. Kondwane Kawaza has spearheaded the efforts to make this United Nations initiative a reality. An alumni of the APFP program in South Africa, he works at Queen Elizabeth Central Hospital in Blantyre, Malawi. He is the country's first neonatologist.
One of the research projects that he's led over time is what we call the CPAP, Pumani machine. Pumani is a local term that essentially means breathe.
CPAP stands for Continuous Positive Airway Pressure, a A CPAP machine is used to deliver constant air pressure into a baby's nose, which helps the air sacs in the lungs stay open and prevent sleep apnea.
As a treatment concept, can be used in any age, but specifically for the pulmonary CPAP, can only be used in babies.
I remember some years back when Kondwani was actually a registrar, we decided together with a team of biomedical engineers from Rice University to think through, can we have this very same technology and does exactly the same thing with the machines that are used in the Western population.
When Dr. Kondwani returned from his pediatric fellowship, he was tasked with adapting the technology for babies in Malawi. His exposure to high-tech machines and his long-term research in CPAP made him the ideal candidate for the job.
At that time, they had tested the pulmonary CPAP, and they had already come up with results that showed that the functionality was the same. But what had remained was use this machine in our patient population and see if it results in a reduction in mortality in babies that are born with severe respiratory distress.
Over time, we started with simple plastic containers, the pump that you use for your fish tanks at home. You know, that simple pump, it was really simple machinery, but you know, we could support breathing for these tiny babies. Over the years, we were able to perfect the equipment. As we speak now, we have actually a commercial machine that is not just being used in Malawi, but other countries within the African regions.
Costing up to 6 times less than machines manufactured in Europe, the Pumani CPAP has become one of the most innovative solutions in helping curb infant mortality in Africa.
The Pumani machine, the cost is around about $800. When you compare that to machines that are $3,000, $5,000, it's a huge difference. Now, the issue is not just the cost, but you know what really is unique about the Pumani machine? It is so rugged. So by rugged, I mean, you know, countries like ours, voltages for electricity, they change. We have power outages, but this machine, it's so robust.
A new user can be trained to operate the Pumani in less than 1 day, and most repairs can be done easily and on site.
Even as a country, as we're pushing towards accelerating reduction in neonatal deaths, CPAP is one of the key interventions that we've introduced.
A clinical trial conducted in 2012 showed that using the Pumani to treat neonatal respiratory distress resulted in 27% absolute improvement in survival as compared to patients treated with oxygen therapy.
As Africans, I think we need to learn to celebrate our successes. I remember going for a conference. Somebody was giving a presentation talking about countries that have achieved MDG number 4. And my heart was pumping, you know, like, gosh, I hope we made it. And lo and behold, they gave Malawi as an example. You should have seen me, how happy I was, telling everybody, I'm Malawian, I'm Malawian. I was a very happy person.
Malawi's achievements are being mimicked in other countries. Next up, Zambia, where doctors are relying on confidence and creativity to care for children and save lives.
It's important to have specialists in Africa. It's important because when you're not specialized, there's a certain level of thinking where you end. But when you become a specialist, you actually start to understand why certain things have to be done. Generally, if people are specialized, our health will improve in Africa as a whole.
The African Pediatric Fellowship Program has been instrumental in advocating for child health on all fronts. In Zambia, one of the fellows, Dr. Kunda Mutesu Kampebwa, is head of department at the University Teaching Hospital in Lusaka. She is currently the only neonatal doctor working in the public sector.
When the abdomen is distended, it splints the diaphragm. So there's no proper breathing that is happening. Whilst I was doing my neonatology training, each fellow was assigned a responsibility to help with teaching South African 6th-year medical students who were coming from the University of Cape Town. The experience gave me enough confidence, found that I could actually train other people in Zambia.
Kunda is very passionate about training the next generation of specialized doctors for Zambia.
Every morning we do a handover round, and that's the time I get to teach them. We do this word round every morning. On the Monday, it's more extensive because we really want to make a plan and we really want to move forward. So on a Tuesday, it won't be as intensive because we know, okay, this one we saw, this is what is happening, how far did we go, and stuff like that.
As you may be aware, our population of Zambia, 50% about that are children under the age of 15 according to the Zambia Demographic Survey of 2014. So what we have now is a nurse who is prepared to manage the adult. But we have very few nurses who have been prepared to manage the children. And so that's why we need people who are masters prepared to teach the other nurses at degree level or at diploma level so that we can spread out these people to man the health facilities that are being attended to by the majority of our population.
Nurse Rogers Gift Benkele is also an APFP fellow and one of the few masters qualified pediatric nurses in Zambia. He established a child health nursing program which trains other nurses to become pediatric specialists. Working together with Dr. Kunda, they hope to empower pediatric healthcare workers throughout Zambia.
And the respirations are 68. Are we together? Then look.
We've been able to do a number of things with him, including neonatal resuscitation. We've taught people how to nest babies. And I think that we make a good team. I like him because he's very open-minded. So the next thing we were discussing with him was to make an advanced skills training manual for people that will work in the neonatal unit.
Okay. You move this one also.
Dr. Kunda believes that in the hospital, any healthcare worker can help reduce neonatal mortality regardless of what skill they may or may not have. She has come up with simple innovations that have transformed neonatal care in her hospital.
When I came back in 2015, I implemented a number of things. One of them was hand washing. We created a kangaroo mother care unit. We started feeding babies early because previously they won't be fed in the first 72 hours. And then we got the CPAP. So after that, we did an inventory. We did an audit to see how mortality had reduced. So in 2014, the case fatality was at 164 deaths per 1,000 admissions. And by the end of 2016, we had come down to 75 per 1,000 admissions.
For Dr. Kunda, studying her pediatric fellowship in South Africa meant that she could see new possibilities back home.
The system of learning in Zambia was that because we didn't have a lot of equipment, we tended to memorize. When I went to Cape Town, it was like we were doing textbook medicine. So you're able to see what results you're getting and you're able to really get to know the stuff than memorizing the things. I felt like being on the African continent and trying to replicate what I had learned would be easier because we are really dealing with Africa. You know, like when you go overseas, you get high-tech things and you just think, okay, this is too expensive, we can't replicate it. Coming back, I've realized that it really did me good to be in Africa because even when I'm talking about things that we can change, it's very easy to justify that it's not happening anywhere else but in Africa. Regarding babies that had HIE.
Being the only neonatologist in the public sector, Dr. Kunda knew something had to change in her country in order to save more babies' lives.
When I went to do my training at the University of Cape Town, I found a brilliant protocol that they were using, and I realized that this protocol could actually be used at home to improve things. So I started by asking them if we could adapt the protocol to our setting. And once they agreed, I asked the heads of department in various different hospitals in Zambia, and they all agreed that we could actually revise our protocol. Yes, because this one we could actually make the big one.
Neonatal protocol are the guidelines and procedures for how a baby should be cared for while in the neonatal unit.
I'm alone and I couldn't be everywhere, and initially the protocol that we had was that existed was actually quite outdated. The protocol is used in the neonatal unit. If a baby comes in and they say, this baby didn't cry, so you start thinking, was this baby asphyxiated? Go to the contents, look for where asphyxia is, and it tells you how you're going to manage that baby. It's making a difference to the management of the baby, because initially people would actually wait for the doctor to come. But now even nurses can start fluids. It's actually helping the staff help the babies.
This new protocol designed by Dr. Kunda has been adapted by all hospitals in Zambia under the Ministry of Health. It has empowered nurses and improved the level of care for newborns across the country.
When I walk in a place and somebody's using the protocol, I just feel very proud, because I feel that that's a contribution that I've made to my country.
Seeing one doctor's work take on a life of its own is the real power of the African Pediatric Fellowship Program. In building a network of dedicated doctors that spans Africa, the hope is to save lives and change futures forever.
Apart from realizing that, okay, I'm saving the baby's life, I just imagine mothers who go home without a baby because the baby died. So the fulfilling thing is really seeing this mom smiling.
My biggest dream is that I would like APFPs to be structured across Africa, because in fact the capacity of the other centres to train and the skills that they can offer are just so phenomenal. There are many, many people that are returning with the capacity who could set that up and actually make that operational and effective in other areas in Africa.
Inside Africa, in association with Zenith Bank.